It is now 11 a.m. Central Standard Time, so we're going to go ahead and get started. So hello, everyone, and thank you for joining us to learn more about the Action Planning Dashboard template. The webinar today is being recorded and will be posted to our website. We will be sending the recording and the slides to all the participants. Please note that there is an attachment for your use during the practice session of the webinar that is included on the meeting invite, and Caleb will also be attaching to the chat box. We're also going to link the presentation of today's webinar into that chat box. I am Shannon Sari, Program Specialist with the National Rural Health Resource Center, which is providing this webinar today. The Delta Region Community Health Systems Development Program is funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. Please connect your video feature by selecting the camera icon in the lower left corner of your screen. Your audio is muted by default to avoid background noise and feedback. Please remain muted unless you have a question. To unmute your line, please select the microphone icon in the lower left corner of your screen. If you dialed in, please press *6 to unmute your line. You can also communicate through the chat box, which is located on the bottom ribbon in the middle of your screen. If you haven't already, please take a moment to type your name, title, and organization into the chat box so we know who's joining us today. This really helps our presenter get a good feel of the audience on the webinar today. So we do have 2 pre-polling questions that we would like you to answer before we get started on today's session. Caleb, please pull up the first polling question. I am confident to unconfident in my understanding of the importance of using a dashboard to drive performance. And then Caleb, if you can just give a few more seconds. It looks like 24% are confident, 29% are somewhat confident, 35% are neutral, 6% are somewhat unconfident, and 6% are unconfident. Next question, please. I am confident to unconfident in my understanding of how to improve performance through better project management. If you can give just a few more seconds. So it looks like 11% are confident, 47% are somewhat confident, 32% are neutral, 5% are somewhat unconfident, and 5% are unconfident. Thank you for participating in those polls. In this session, participants will get an overview of the new action planning template and discuss how to use the tool to support the implementation of the action plans. The objective is to gain a better understanding of the importance of using a dashboard to drive performance and learn how to improve performance through better project management. The goal is to assist organizational leaders with implementing best practices that result in performance improvements. It is my pleasure today to introduce today's presenter, Matt Mendis. Matt is a healthcare professional with more than 20 years of executive and consulting experience. He has worked in a variety of settings ranging from an academic medical center to a small community hospital with an integrated delivery system. With the goal of improving healthcare delivery and outcomes, Matt excels as a change agent by advising hospitals and health systems about how they can thrive in challenging market conditions. Matt also served as the CEO and COO of two not-for-profit community hospitals, where he was responsible for strategy and overall operations prior to his consulting roles. He is passionate with leading and finds great satisfaction in helping others achieve extraordinary results. Matt, I'm now going to turn it over to you.
Thank you, Shannon, and hello, everyone. It's great to be with you and to share some time with you this morning or this afternoon, depending on where you're joining us from. And really also great to see so many friends and names and faces that we've recognized and that we've worked with. So really do enjoy the opportunity to reconnect with you folks today. So thank you for that introduction, Shannon. If we can go ahead and advance to the next, please. Or if it's easier, you can give me control and I can drive, whatever works better for you. So as control, Matt. You want to give me control? Okay. All right, let me do that. Bear with me here. Okay, hopefully everybody can see the screen now. Is that, you see the title screen?
Yep, looks good.
Okay, all right. So we're going to focus on a few things today. These are our learning objectives. Certainly we want to spend a little bit of time walking through what the dashboard is, as well as some of the other change management tool suite to really help you all to elevate and drive organizational performance. We also want to talk about some of the concepts around project management, and we'll talk about specifically how to use that tool within the suite. And then we also want to talk about ways in which we can help you all adopt these tools and principles to really enhance your performance in your own respective organizations. So we're going to touch on some of the common pitfalls, some of the things that I see organizations struggle with, and provide you with some strategies and some tools to help you navigate and mitigate those areas. I'm going to introduce you to what I describe as really the 4 Ps of driving performance. We're going to have an opportunity to review the tool suite, many of which I believe folks on this webinar have had an opportunity to see. And we're going to do a little practice session as well, be able to have a chance to actually use the tool and become more accustomed to it. And then I want to leave you with some thoughts around what other best practices are out there around navigating some of the additional hazards of driving performance improvement. And then we'll leave some time for questions and answers. So let's talk about some of those common pitfalls. Now, organization may not have a clear vision. They may not have gone through the exercise of really casting forward what is that future aspirational state, that destination that the organization aspires to get to. In addition to that, without that vision, they may not have corresponding strategic objectives that have been defined to support that vision. So it's incredibly important to really have gone through that process of really defining what that future desired aspirational state looks like in a way that is tangible. In addition to that, it's important to have a plan and to have a plan that enables you to really track what those supporting objectives are. And so a lack of that plan, as they say, without a roadmap, it doesn't really matter where you go. Any destination is really going to be where you end up on your journey without that roadmap. The other pitfall is not taking time to actually break the plan down into manageable pieces and parts, specifically around action steps that can be defined in a more granular fashion to help the organization move towards closure on that particular goal. One area that I see happen a lot is the tendency to want to pursue multiple things simultaneously, and so organizations kind of get into the shock and awe mode of attempting to do too much. And really what happens here is that, as we know, many of us on this webinar wear multiple hats. You have a lot of competing priorities, a lot of responsibilities, and so it's important that we don't overload or overextend the organization. So we really want to make sure that we've balanced our approach and how we actually execute. Not tracking performance. This is an area where we may have a plan, we may have taken the time to break it down into manageable pieces, but if we're not actively measuring and monitoring our progress, then how do we know we've arrived at success? How do we know that we've actually made strides forward? So it's really important to be able to have an understanding of not only our performance, but also where did we start? What was the baseline? What was the desired target? And how are we trending our performance towards target? And then lastly, have we really defined the owners and really set in place some system of accountability to ensure that we've got a plan, we have broken the plan into manageable pieces, and we're clear about who's responsible and who's on point for being able to shepherd those projects through the finish line. So those are some of the common pitfalls. And one of the areas where I think we've got some opportunities to bring some resources forward for all of you is around some of the navigation tools that we've developed in this suite that we'll be sharing with you. And we define it in really as what we describe here as the 4 Ps. We're going to show you what that means in terms of prioritizing, planning, performance measurement, and then following that up lastly with project management. So before we dive in, I think it's helpful to talk about a story of an amazing dream that a 6'5" Kiwi dreamt of in the early 1950s. And I'm talking about Edmund Hillary, of course, and he had arguably what we could say was a big, hairy, audacious goal, or a BHAG for the folks that are familiar. And he really aspired to take his passion for climbing and to climb the tallest peak in the world. And so, again, we're talking about Mount Everest, of course, 29,035 feet. Now, this is the altitude where jumbo jets are flying. This was something that no human had ever done before. And it was viewed as something that was unattainable and largely out of reach for any human. And he was a beekeeper, by the way. This was his profession, and he used his beekeeping to finance his expedition. As we know, he was successful. He and his partner, Tenzing Norgay, were successful in climbing Everest in 1953. And upon arrival back a few months after his return, Queen Elizabeth knighted him for this tremendous accomplishment. And this story really set, I think, a lot of things in motion for exploration. And in particular, it inspired a lot of explorers following Sir Edmund and Tenzing. And so, of course, we know modern day there are lots of expeditions to Mount Everest, and now this is not really viewed as an insurmountable task. Of course, it has lots of risks, and there's certainly many challenges associated with this. But what also was of interest was that the 2 sons of both Edmund Hillary and Tenzing Norgay summited on 2002. So in addition to the legacy of additional explorers, they also had their own connection to family as their next generation were successful. So how do you even think about something like this, a big goal, something that's a BHAG, it seems like a stretch, something that's insurmountable, out of reach? Yeah, well, I think it's really, we can draw inspiration from what Sir Edmund did back in the 1950s. He started with that dream, his BHAG, and he started to craft a plan. How do I get from the base here all the way to that 29,000-foot summit? And so he broke his plan down into the training, the equipment needs, the provisions, the travel logistics, the Sherpa support, a whole host of items that were important to consider in this expedition. In addition to breaking down those resource components, he also thought about this goal in terms of what were the critical milestones, what were the steps that had to be managed that would enable he and his team to actually start to make strides and move from the bottom level here to the first base camp, the second, the third, fourth, and finally make the run for the summit. And of course, it takes a team. Change happens through people. And so having good change principles and tools in place is critically important for organizations and for explorers as well. And so Sir Edmund and Tenzing crafted a team, and they really brought that team around this plan, and they worked that plan, and they monitored their progress on a day-by-day basis. And of course, they were successful. And so with any great accomplishment, we always want to take that time and pause and celebrate and reflect and learn. And what could we take away from that experience and re-embed that back into the organization. So there were probably many, many learnings that came from that initial expedition to Mount Everest here. You can see here there's a new route and an old route. So after climbing multiple times, modern day explorers now have really honed which route is best and which options are best. And the same is true for organizations that are embarking on a change journey. We want to learn from the challenges we have, some of the failures and pitfalls that we experience, and take those reflections and help ourselves be better going forward. So I hope that this story of Sir Edmund helps you to think about all of the initiatives that you all have and that you're pursuing today. We know that you all have a lot of different competing priorities, a lot of things that are critically important to your organizations and to your community. And so some of these tools and principles I'm hoping will be helpful to you as you start to manage the process of continuous improvement. So those 4 Ps, as we described earlier, begins first with understanding what are the priorities. And these priorities are often a connection to the vision and the mission of the organization, as well as the core strategies. And so the priorities of the organization will flow from mission, vision, values, and strategies. And so they need to support and be aligned well with the organization's overarching desire and direction. The second phase is around planning. So we take each of your priorities and we break them down into manageable pieces where we really distill down, who owns this particular priority objective, what is the measurable and time phase goal, and then what are the specific tactical steps towards achieving that particular initiative. And then we move into the performance monitoring phase, where we measure, we monitor each of those initiatives, tracking that performance to target and making course corrections as we go along, recognizing that the plan is a living tool and a living document that you're monitoring in real time and you're adapting to it in real time and making changes on the fly as needed. The last P is around project management. So really having a visual representation of all of the various projects and initiatives the organization is pursuing and being able to help to appropriately sequence and time phase those projects, recognizing that some are interdependent with one another so that project 3 doesn't happen until project 2 is completed, but also understanding that by having a visual representation, we can avoid that whole scenario of shocking and awing the organization with overextension. And so we're able to better manage what's being done by the organization over a period of time. So as I said before, just kind of jumping in to look at these at a more high level, the prioritization exercise followed by the planning, and we're going to walk through each of these components here, followed by performance monitoring, and then lastly by project management. And so what I want to do now is for folks that Caleb put in the chat box, the Excel tool suite. And so if you all can open that document, we're going to focus on first, I'm going to assume that we've already done our prioritization. So with all of our action planning sessions, at this point, we've already gone through and identified what your priorities are. So we're going to move to the second phase of actually taking each of those individual priorities and now building out specific action plans around them. So the first thing we're going to want to do, let me back up here and just kind of walk through real fast before we dive into the training practice piece. We want to understand, and this will be auto-populated from the tool. So whatever initiatives were within that first prioritization exercise, these items will populate straight into this white field here, this action plan field there. So that's going to be already pre-populated. But the second step is to really understand and define who is the primary person responsible for orchestrating this particular goal. And that's followed up by defining, are there critical issues or challenges that we need to be aware of that we have to overcome? And it's important to understand what those issues are, because if we haven't really taken the time to reflect on the challenges and the issues we're dealing with, we may not come up with an appropriate response to how we mitigate or solve that challenge. We might have a great goal, but it might just be focused on the wrong thing. So this is an important step. Next, we want to define the goal in a way that it's specific, measurable, attainable, realistic, and time-phased. And so this is where we really don't want to have something that is too subjective or nebulous. We want something to be very clear, so that if we look at this plan in a month or two, we'll understand exactly what we meant when we said what we were trying to accomplish. So we want to make sure it's very clear. Of course, the target date, very self-explanatory, but this is when we anticipate completing that particular goal. The action steps are the specific tactical steps that we have to accomplish to build ourselves towards attaining that goal. So these are the things that, think of them as stepping stones. If we naturally accomplish these 1 through 5 items, are they going to lead us towards accomplishment of that overarching goal? And like the overall owner here, we want to identify individual owners for each of the action steps, as well as the target dates, and then any other resources or other information that we want to capture for each individual action item. So those are the steps around using the action plan template. In your Excel spreadsheet document, that will be the yellow tabs. I believe there are 10 of them. And so I will pause real quick. I'm going to see if I can maybe do a little bit of a shift here.
Matt, as you do that, I just want to point out too, for folks that joined who may have not seen the attachment in the chat box, it's also attached to the meeting invitation as well.
Yeah, thank you. That's great. All right, I'm going to jump real quick to the other document, and then we'll go back. Okay. So this was the first priority tab I was talking about earlier. So you all should hopefully have this document pulled up. You're going to type in your priority recommendations. And so this exercise is going to happen when we do action planning sessions with you. But for today's purpose, feel free just to put anything in there that you want. Just put a goal in there that you may have in mind. And for our purposes, I'm sticking with the summiting Mount Everest theme here. So we're going to climb to base camp 1, and I'm going to go to the first action plan tab. So I just reviewed what that looked like on screen with you in PowerPoint. And the first thing you're going to want to do is you want to identify that owner. And so go ahead and just type in whoever's responsible for whatever particular action item you might have identified here. And then we're going to want to go to the second step here around identifying issues or challenges. And so for climbing Everest, they were concerned about a narrow season to accomplish that. They had a weather window to get this done. And they're also always worried about difficulty with dangerous terrain and hazards. So again, understanding their overarching goal here, and then breaking down this goal into, again, SMART terms. You know, is it specific enough? Is it measurable? Is it attainable? Is it realistic? And is it time-phased? So in this case, they broke this goal down into climbing 500 meters to base camp 1. And they wanted to get this done next month. So that's the first portion here. And then we want to break down the key tactical action steps that support accomplishment of the goal. And so again, and you should be just filling in anything you want here just to kind of get familiar with the tool. And I just pre-populated 5 tactical steps here, as you can see. So scout the area, identify the gear, pack the provisions and gear, assemble your Sherpa support, and begin the journey. And you can see where the owners are. And then I set some target timeframes as well. Okay, so we just kind of walked through that first action plan. Again, populating the owner, the issues, the goal, the target date, action steps, owners, target dates, and other key information. So now that you've got that first action plan created, we want to build out some performance monitoring for that plan. So we're moving into this phase here. This is the third P, performance monitoring. And there's some key steps around this. The first is that we want to understand, and by the way, the tool actually auto-populates. So if you built out anything in that priority tab, that first tab, it's going to auto-populate in the white fields here. But the first thing we're going to identify is really understanding what that metric is, or what that measure of success is. So what are we going to use to measure the performance for that particular goal? And again, for our example, we're climbing Everest, so we're going to do meters climbed per day. That's our metric of success. And we want to understand the baseline. What's the historical performance starting point for the organization? And for our story here, our intrepid explorers were starting at a baseline of about 1,200 meters per month, or 40 per day. And they knew they needed to do more than that to reach their target of 1,475 a month, or 50 a day. But again, similar to you all, as you're building out your action plans, and we want to understand not only what the measure is or in the baseline, but we want to understand more importantly, what's your threshold target? Where do we aspire to get to for this particular initiative, this particular goal? So that's what we're going to do here. The owner is auto-populated as well from the tool. So that's why that field is white. So any yellow fields that you see are going to be fields that you all will populate. Lastly, we want to look at performance on a monthly basis. And we use a simple stoplight approach to this. So red is below target, yellow is moving towards target, and green is above target. And so you can just simply drop that in right into the fields. And so again, first thing you would do as you're walking through your dashboard tab, which I believe is the blue tab, you're going to choose your measure for your particular action item, identify the baseline, identify your target that you're striving for. And again, this is the target that would be for the completion of that goal. And if that goal is 6 months out, then we would know that we're measuring this performance over a 6-month period of time, and showing how we're striving towards that performance. And so I'll quickly show you this in the actual tool. Are you all seeing? I'm not sure I got the right screen there.
Yeah, we were seeing the presentation again.
Okay, thank you. Sorry, a little bit of juggling here. Okay, so we're going to move now. So these are your yellow action planning tabs. We're going to just scroll the tool over, and we're going to choose, actually it's the green tab that I was referring to. So again, this auto-populates in from this initial priority recommendations tab. And actually, as you populated in this specific quantifiable goal, it will now populate automatically into this cell here. And as we just walk through, we would then want to identify the measure, the baseline performance target, and then just assign your result as you go along. Okay, so that's the dashboard. And now we're going to move lastly to the project management side of, so we've now prioritized, we've identified those core priority initiatives, we've built out the action plans and the specific tactical steps, the timing, the accountabilities for all of those identified priority initiatives. We've now built out a dashboard for each of those initiatives, so we're clear about the performance measures, the baseline scores, the target scores, and we're now able to start to track and measure and monitor performance. And now we want to move into the project management side of this. So this particular tool, the blue tab, so for this tab at the right, action tool. And the first thing I'm going to do is to define the time. White fields will populate from the yellow action tab, so it'll give you the goal and the completion. So now this needs to be, how long will it take for the entire duration of this particular initiative from start to finish. And then we want to put in here the anticipated start and end dates for that particular initiative. The owner is auto-populated, so we don't need to worry about that. But the time blocks, again, I've got it broken down by month. If you can also use this tool and make it much more granular, if you have something that's more immediate, or if you want to break it down into a narrower time window, maybe it's looking at it on a weekly or a bi-weekly basis, you certainly can make those changes. Just go in here and change the heading. For our purposes, I've designed it just for the month. And you can see here then, we understood that this was going to be a 6-month project. We're starting in month 1, and we just populate that cell out. And so the same would be true as you build out your project plan. You're going to just populate or color the corresponding blocks with each of the months. So if we're starting in month 4, we would populate a cell here and move it across depending on how many months it would take. And I'm going to show you what that looks like. Are you all seeing the, okay. So this, now we'll go to the project management tab. So this is the blue tab that I referenced earlier. And again, kind of walking through the example I just showed you on the PowerPoint in the actual tool. So you'll see that anything that you had built out earlier in your action plan pre-populated into the white fields here. And so in this case now, you just need to fill these in. So we're going to say this is going to take us a month. We're going to start in June. We're going to finish in July. We've already got the owner. And so in this case, we're just going to drag these. I'm just going to drag there and make a color selection. And you can clear this out if you want, whatever works best for you. Again, this tool is meant to be very easy to use, very intuitive and dynamic, so you can modify and customize it to your needs. Let's just say, for argument's sake, that there were 3 more goals here. And what I want to illustrate is that the idea of goals sequencing and projects butting up to one another. And so in this case, what's helpful is in your planning, you may find that you've built out a lot of different plans, and when you actually sit down and start to do this phase of the work where you're actually defining when this work will cascade over time, you might realize very quickly as you build this visual tool out, it's just a Gantt chart, you may realize that, wait a second, we are potentially setting ourselves up to be overextended because we've got a number of things that are coming in around the same time. And we want to stagger this work out. So in this case, you might say, well, you know what? We actually need to move that out a little bit. And we want to move this one out a little bit. And maybe this one comes over here. And so what you're able to do is have a better understanding of when your resources are going to be committed towards different work. And so instead of pursuing 3 or 4 things simultaneously now, we're actually able to plan for things to start in a staggered fashion. So in this example, this project would start first. It's going to start here. It's 3 months. It finishes here. The second project's going to start here. 3 months into that, another project comes online. And then you can see here, there's another one coming online towards around the 4th month of this 3rd project. Again, the importance here is that this is all around resource management and making sure that you're able to appropriately sequence your projects and not overload the organization. So I recommend going through this exercise, mapping out the entire project, and then you may want to make some modifications to your timing if you realize that you've potentially set yourself up to pursue too many things at the same time. So it's very helpful to go through this. It gives you a visual representation. Once this is cleaned up, you have now a very nice, simple tool that can be used to share with all your stakeholders, what the projects are, when they start, when they finish, and be able to widely share that information across the organization, so that as your teams come online, they're very clear about expectations of when things start, when they end. And again, another piece of this is that we have to recognize that there are some things that you all will be pursuing that maybe an individual is tasked with doing something, but more than likely it's going to be teams. It's going to be action teams of people coming together and pursuing this work. And so we're going to want to think about how do we actually bring people together and support them in that process of orchestrating change. So those are the main components of the suite of tools. Again, just as a quick refresh, we start with this first tab here, which is where we would do the prioritization. With our action planning sessions, with Stroudwater's work, we do this with all of you, and for some of you on this webinar, we've already been through this process with you. But either way, this tool can be used for other components of the work that you're pursuing. Again, it starts with the prioritization, understanding what those key initiatives are, and then for each of those priority areas, building out specific action plans that really take that perhaps an insurmountable, overwhelming type of a goal and helping you to break it down into manageable pieces. And so this is a really critical part of the process where we actually take this really big goal, we break it down into manageable parts and components. And then we're able to start to track and measure and monitor and also share and cascade that information so that all of our team is aligned and aware of performance, and we're able to hold one another accountable. And then finally, we also have a view of how we manage and orchestrate the project kind of at a macro level. So those are the 4 Ps that I described earlier. And we're going to jump back in now. And talk briefly about a few other potential hazards that folks may experience as you're on your performance improvement journey. Hopefully the 4 Ps will help you navigate a whole host of those issues like we described earlier, but there are a few other things that you may want to be aware of that might be trip hazards. One thing is that the organizations that I see gain traction and do well and get momentum and have a cadence and rhythm to improving change is those that are leadership driven, meaning that the leadership team, the CEO and the C-suite owns the change, and they haven't delegated the implementation of the plan to someone else. They actually are at the front leading the change. And so we want to make sure that you all remain involved in this work and that we don't disconnect from the important aspect of actually executing and driving the desired performance improvement. The other is that we didn't think about what's the structure of orchestrating change. As I said earlier, performance improvement happens through people, and it takes some intentionality around designing a collaborative team structure to help support the change and to help folks come together in ways that unlock their full potential. Another trip hazard is failure to fully engage the entire organization. For folks that have been through action planning sessions with me, I always stress at the end of the session that while we've done good work and we've crafted a draft plan, the real work will really be done by those that are actually not in the session with you at that time. It's all of the stakeholders that are with your patients and part of that patient care team, the direct and indirect patient caregivers that are the ones that are going to have the high touch around this work that you're going to do. And so we want to make sure that we've fully engaged all members of the organization, because this journey is going to take all of the team to help the organization. And again, I shared with you the project plan Gantt chart tool, and it's so important to really have a visual representation of the work. And I see so many organizations that don't take that extra step to really map out what that project plan looks like in a very visual way, and to really craft a plan that is global and representative of all of the organization's initiatives. I know that you all are all pursuing multiple initiatives across different fronts: financial, operational, quality, rev cycle, practice management, and other areas. And it's important to take some of these principles and think about things in a global way so that you're able to keep eyes on all of your various projects and also to measure that performance and to really regulate, monitor the cadence of change and the rhythm of that change, and to make sure that you're appropriately regulating how fast you pursue things, or maybe you'll find that you might want to slow things down or make some shifts. But having that project plan gives you optics into that. And again, this goes back to the engagement question. And so we really need to make sure that this plan, the results of these initiatives, are not your best kept secret. You know, this work is going to be a team sport. It's going to require all of your organization. And we really want to be sure that we've appropriately communicated the importance of this, what it means to them personally, how it connects to the mission, to the vision of the organization, how it's going to ultimately help you all to be successful and viable and better serving your respective communities. And so we want to do that by frequently communicating all aspects of this particular project that we're working on. And we also need to be sure that we've embedded time in here to reflect and to celebrate successes. We want to make sure that as we've had some wins, that we've taken time to pause and reflect and celebrate. We want to learn from the challenges, from the failures that we've had, and adapt and innovate. We want to take those learnings and specifically those things that we intend to continue to do and embed that back into the organization. And maybe the things that need to be refined, we need to reflect on and make those appropriate changes so that we're adapting in real time and that we're innovating and learning from the experience and that we're feeding that back into the organization. So ways that we can navigate some of these additional hazards, talking about establishment of a change council or a change structure, specifically chartering action teams, identifying ways in which we can bring in collaborative problem-solving tools, having a communication plan, having a strategy and approach by which we actually cascade information and engage people across all vehicles of communication. And then again, that reflection, celebration, and adaptation is so important. So the change structure, again, very simple concept here, but the reality is I'm a big proponent of building out some kind of a structure for orchestrating your change. And it's likely that you already have something in place. You may have a senior leadership team meeting that meets on a regular basis. You may have an operating council or a strategy implementation council or some other body, some other committee, some other task force. But in essence, this operational improvement council should be commissioned for the sole purpose of pursuing the work that has been defined through our engagements with you. And so really working with the rest of the organization to make sure that you have a clear plan, a clear approach, accountability mechanisms around how do you do the work of improving the organization's performance. And as we mentioned earlier, this is going to take teams of people to do the work. And so in this example, we've got just a team structure of 4 action teams, and these action teams would meet on a periodic basis and report back into the operating council on progress made, challenges that they've had, resource needs, but really in essence, they're reporting in from an accountability perspective, and they're also looking to this body here, the Operational Improvement Council, as a council that's going to help provide them some support and resources and direction. The other important thing here is that action teams should not be just comprised of leaders on this call. We should be thinking about how do we engage those that are our frontline associates? How do we get folks that maybe historically haven't had an opportunity to play a role in a team or in performance improvement activities? And let's be very focused around understanding who those individuals might be that bring a unique skill, knowledge, ability, or perspective to the particular task at hand. And let's identify some growth and professional development opportunities for those folks, and let's get them engaged. We want to foster ownership here, and this is a really perfect vehicle to do that. Chartering each action team. So for the 4 examples that I showed you earlier, we want to be clear about what we're asking people to do. And a charter is a great tool to help provide some guardrails around the scope of a project and the scope of an action team. And so this just gives you an example of what a charter may look like. But again, defining what that purpose is, so giving them some clarity about what their charge is, what their focus area is, and then deliverables. And when I talk about deliverables, I'm talking about what are the specific work products that this particular action team is going to create. Are they going to create a plan? Are they going to conduct an analysis? Are they going to redefine a process? But this team is going to create something and bring a tangible solution forward. And so we want to be clear about what that expectation is. And then we also want to help define the expectations of that membership group. So how often do we anticipate them meeting? What kind of materials are they going to need? What kind of time commitment are we thinking over time? And then we also want to give thought to the composition of the team. And again, composition doesn't have to be just, well, this is about inpatient nursing and swing bed, and this project is around swing bed. So of course we want it to be the nursing team and the case management team. But I would also encourage you to think about, are there other disciplines, other areas that should be included? Having fresh eyes and fresh perspective is really, really important here. And we can infuse some new ideas to areas that maybe hadn't thought about different approaches. And so thinking about composition, not only in terms of just that functional area, but also in terms of what skills, knowledge, and abilities are required for this particular challenge, this particular goal. We want to utilize collaborative problem-solving techniques. Again, we want to foster a place where folks feel free to engage, free to have healthy, spirited discussion when challenges arise, but ultimately that we're working towards the same common goal. And there's some key tenets around how we set this in motion. And one of them is to have meetings, and this is crazy, but have a meeting that has an actual agenda. And a lot of this stuff, you may say, well, these are very simple principles, but the reality is, in my experience, that many of these things are simple, but they're not often followed. And so, if we can embed some of these approaches into the discipline of how we orchestrate change, I promise you will see the difference from it. So let's make sure our meetings have agendas. And let's make sure also that we have neutral facilitators that are part of these meetings, so that we've got a facilitator who is there objectively to help guide the discussion of this team in this particular meeting, and they work with the leader of the meeting. Being a leader of a particular meeting or team and facilitating is a very tricky situation. And it's always best when you've got somebody who can be neutral, who can focus on process and allow the leader to actually focus on content and engaging with the team. So the facilitator plays a very key role and is there to help foster that collaboration and engagement. Now, these agendas are important, and because they bookend the work of these teams. And I like to think about team meetings as links in a chain. And each of the links, they start with understanding first and foremost, what is it we're hoping to accomplish with the time we're spending together, followed with what are those action items that we're leaving with at the end of this meeting. And so those action items connect to the desired outcomes of the next meeting. And so you've got a link of all these meetings, and each of these meetings are ideally advancing you towards completion of your desired goal. All of the meetings are debriefed. So we want to learn what went well, and we want to continue, as well as what can we do differently going forward. So again, in the spirit of continuous improvement, we've embedded that into our approach for how we conduct meetings. We talked earlier about the importance of communication. We should be doing communication in the most transparent fashion that we can across the organization and as wide a way as possible. There's lots of different ways to do it. We can do it in terms of management meetings, leadership team meetings, department town hall meetings, employee forums, leadership rounding, board meetings, of course, medical staff meetings. All of those areas are important touch points with various stakeholders. And we want to make sure that we've cascaded this plan, this project, and the importance that it has to the organization, as well as the importance that it has for all of those stakeholders engaging. And we want to make sure that we share progress. Again, let's not have that be the best kept secret. Let's make sure the organization's aware of the progress we're making, and we use that in a way to help drive accountability and ownership. And we want to make sure we periodically reflect. Let's make sure that we've taken the time to pause, to celebrate those successes, to learn and debrief, and to sunset those teams. When they've accomplished their goals, they don't work in perpetuity. We thank them, we celebrate them, and we formally disband those teams so that they can move on to other areas of responsibility. And we want to make sure that we're soliciting ideas. from all of your stakeholders. And I often ask the question of, what would it look like if you asked, if you focus on a particular challenge in your organization, and you asked your entire organization, all of the associates in your hospital, let's say there are 200 people, give me just 2 ideas for solving this particular challenge. You've got 400 ideas to work with there. Now, I'm not suggesting that 400 ideas are all going to be great ideas, but I think that there's probably a good chance that of those 400 ideas, there's probably a good subset of them. Maybe there are 10% of those that are actually pretty solid, worth investigating further. And of those 40, maybe there's actually 14 of them that are actually things that you could pursue and implement and actually see results coming from it. What I'm talking about here is a learning organization and creating an innovation cycle within the organization, getting people to be comfortable sharing ideas and being comfortable soliciting input from all areas of the organization. So I've covered a lot. We've got about 10 minutes remaining, and love to open up the floor and the chat for thoughts, reactions, questions, comments. Let's see what's out there.
Please feel free to come off mute, or if you type your question in the chat box, I can read that as well. In the meantime, Matt, I'm going to have Caleb take over from here for our post-polling questions, but I'll leave a few moments in case any questions come through. All right. Well, if you think of any questions, please feel free to throw them in the chat or come off mute. Thank you so much, Matt. Caleb already pulled up the first polling question, but I am confident to unconfident in my understanding of the importance of using a dashboard to drive performance. And then if we could give just a few more moments. So 52% are confident, 38% are somewhat confident, and 10% are neutral. The second polling question, I am confident to unconfident in my understanding of how to improve performance through better project management. Couple more seconds, please. So 45% are confident, another 45% are somewhat confident, and 9% are neutral. The last polling question, I am confident to unconfident that I will apply the action plan tool provided through the DRCHSD program to support the implementation of best practice recommendations and monitor success. Couple more seconds. %50 are confident, 32% are somewhat confident, 14% are neutral, and 5% are somewhat unconfident. Thank you all for participating in those post-polling questions. So I know Matt had already mentioned that he is open for questions or comments. Did anyone think of anything they'd like to comment?
One thing I would like just to reflect, it's great to see that we definitely went higher on the confidence from the pre and post. So happy to see that folks see some value in these tools. It's really around having a discipline of how you orchestrate the change and how do you engage your team. And I guess one thing I'm really curious, I'd love to hear from the group, how many of you all use any kind of a Gantt chart approach or a project planning approach for managing your work? Is that something that folks are doing? Is that something that is new? I'm just really curious to hear from the group.
Hey, this is Ann from Monroe County Hospital. Thanks, Matt. This has been wonderful. I'm the quality director, PI, and all that. And we use a form similar to what we just did with your spreadsheets for PI. But I think in some situations, some projects, that your form works even better. And just a little while ago, I was talking to our marketing director, who's actually on this call, about an issue that I felt like we were having with our return response rates from our vendor that we use for HCAHPS and other patient satisfaction. And in an email, I outlined to him what I felt like the problems were and what I would like to see happen. But as I'm looking at your tool and working this tool, I mean, I use that instead of climbing the peak. I'm climbing another peak, and it just fit perfectly. So I'm gonna share it. I just chatted with her on here about what I think will work, and I'm gonna use it for that. So I don't know if that's what y'all asked, but that was some feedback that I had. So thanks.
Great feedback, Ann. Thanks so much.
How about any others? We did have something come through the chat box. This approach is new to me, but promises to be very useful, not just for our various DRCHSD projects, but for other projects as well. Stealing shamelessly. And that was
Thank
from
you, Doug.
Tanner.
Yeah. Hey, you take as you need. This is for all of you, and appreciate those kind words. And you know, we really want this to be a process that is intuitive for you. That was the design of this, is that, hey, change we know can be challenging, and we want to bring tools forward that help you to overcome some of the natural friction points that you experience. So appreciate the comments.
And on that note, if anyone thinks of any questions or comments that they would like to share, please feel free to reach out to either myself or Matt. On that note, once again, thank you, Matt, so much for your time and expertise today. Also, thank you to all of the Delta program participants for joining us. I hope you found this session beneficial. And as always, like I mentioned, please feel free to reach out with any additional questions. I hope everybody has a good day, and I don't think anyone will be upset to get a couple minutes back to their day. Have a good day.
Thanks, everybody. Nice to see you all. Enjoy. Bye-bye.
Bye.